just finished the dental with Scratch, and we're with Dr. Tolley. What's your impressions of this horse?
Well, I think he's about 9 years old. He's got a good coat with the exception of some healing scarring that I think is pretty superficial. I don't see any primary skin disease going on at that point. He's got a condition score of 5, so he's in a nice weight. We're going to have to watch this horse as he gets older. He's probably, like, if he is some Morgan in him, he's an easy keeper, and he might be a insulin-resistant kind of candidate, but that's certainly not a problem today. He's got good feet and legs, nice feet, exceptionally nice feet, actually, and he's well trimmed at this time, so that's not a problem. His dentistry was unremarkable. He had a couple little ulcers, buccal ulcers in his gums back in his last upper molars, which we fixed that problem. A little bit of spikes in his first lower molars that would have been a problem with the bit. He was pretty sharp in his upper first premolars, would have been a problem with the bit. He did have a little bit of an irregular incisor bite, which we leveled out. I'm not sure why, but not a big deal, but we leveled that out a little bit. Other than that, he seems very healthy to me. He's amazingly well behaved today, so John's been doing a good job so far to get him in here quietly and have him behave himself, so we're pretty happy. And we did a fecal egg per gram count, which was negative, so parasites are not an issue today. So I think we can go on with him and follow the program. We vaccinated him for sleeping sickness, tetanus, West Nile, influenza, and herpes or rhino.
And then we're going to redo that in a month.
And we're going to do that in a month, redo that in a month, unless you have a history of him being previously vaccinated.
Great. And when you mentioned his body score was 5, is that about where we want him at? No.
That's a 5 out of 9, so that's just right.
Okay, good.
No heavier. Okay. Now, when you really get to riding him, he might, in the summer with the heat, he might lose a little more weight. He might lose a little weight, which he could afford to do. So you've got the room there to have him lose 50 pounds and not have him looked at. So that's okay.
Great. Thanks a lot, Dr. Tolley.
My pleasure. Thank you.